Hi there, I'm Dr. Ratna Maheshwari, and here at Enable we discuss all topics related to bone, joint and muscle health in growing children. A child's fine motor skills get affected by the quality of a child's seating. Poor postural habits make for a fidgety learner. Amid the COVID-19 pandemic, many students remain in a distance learning arrangement. Therefore, an ergonomically correct distance learning setup is important, not just in school but also at home. Sitting on the couch, bed or floor promotes poor posture and therefore must be avoided. In a normal upright position, the spine has some pronounced curves from front to back, resembling the letter S, that aids in its flexibility, which is greatly increased by cushions between the vertebrae called discs. These curves are developing in early childhood and are more easily discernible around the ages of 9 to 10 years. Long sitting forces the spine from its natural S shape into an unnatural C shape. The C shape is bad for the body. It puts excessive pressure on the discs and stretches out the ligaments. The bony prominences that we sit on are called the sits bones. A good seating posture is the one where the sits bones are anchored well and are in a healthy neutral position. This in turn encourages the spine above to be stacked in a healthy S shape. When we slide down in the seat, we tilt the sits bone backwards into a harmful position. It's almost like sitting on the tailbone rather than the sits bone in this position. This forces the spine above to go into a C position. The basic design of conventional seating wasn't meant for many hours of use. Therefore, in order to make chronic sitting as safe as possible, we have to be mindful of the following points, starting with the shape of the chair. Many chairs can literally mold the sitter into the most harmful positions. A forward curved chair will thrust the head forward and make it inevitable to slide down and forward in the seat, tilting the sits bones backwards. This makes the whole spine round and is terrible for growing bodies. A side-to-side curve in the chair pushes the shoulder blades forward, contributing to roundedness of the upper back. Therefore, a straight side and a straight front backrest is better for children. Apart from the chair, most children are sitting on furniture that is just not the right height for them. If the desk is too high, the elbows and shoulder will be shrugged up and working at awkward angles. If the desk is too low, the whole body will collapse forward. So what is the ideal chair seating and desk height? Approximately the seating height of the chair is 1/3 the child's height and the desk surface is approximately half the child's height. So when the child is seated, this means that the desk height is approximately at the level of the elbow or up to 2 inches higher. This allows the shoulder to be relaxed and provides a comfortable horizontal position for the arm and the hand to work. The ideal chair height allows the feet to be firmly on the floor and the thigh fully supported on the chair. This allows the feet to take some weight in maintaining the posture and improves the stability in sitting. There must be some space between the knees, and both feet on the floor offers a wider base of support. Sitting on one foot is a habit with many girls, which if habitual can contribute to a sideways curvature in the spine. If the seating is too high, it causes the feet to dangle in the air. This inevitably causes a forward stoop. Also, the underside of the thighs become compressed, causing discomfort and again causing the child to move forward in the direction of the suspended feet. So the best way to avoid this is to use a box of books or footstool to support the feet. Similarly, if the table is too high, one can place pillows, cushion or folded towels on the chair to lift the child higher. so that they are in a more comfortable position in relation to the surface of the table. When seating them on the chair, think 90-90-90. 90 degrees of hip flexion, 90 degrees of knee flexion, and feet flat on the floor with ankles at 90 degrees. Keep a small gap between the edge of your seat and the back of the knees. Shoulder blades should sit flat on the back and not protrude. A fundamental direction for correct sitting is to lean forward and then push back in the chair as far as possible and finally sit up straight. Any forward or backward recline should be from the hips rather than the waist to avoid the C position. The screen should be one arm length, which is approximately 18 to 24 inches. Place the screen in front of the child instead of letting them hold it in their laps. The top of the screen should be just below the eye level. An inclined desk which tilts up and down can also help mitigate hunching that comes with traditional work surfaces. However, this is not often practical. Instead, angle adjustable risers or wedges or stands can be trialed. Sustainable healthy posture is one of relaxation. Yet, we must remember that there is no posture that can be maintained for too long. Frequent changes in body position is really beneficial. The human body, with over 360 joints and 600 muscles, is designed to move. But due to our sedentary lifestyle today, we are sitting more than ever, something our body is not built to do. A timer or on-screen reminder to simply get up every 30 minutes, do a few stretches, a few squats, a few jumping jacks is all that is needed. Teaching children about their shoulder blades and sits bone and how to anchor it and elongate their spine will help them with more physical stamina and less pain through life. Schools over 100 years ago recognized that posture in a growing child is more likely to go astray and therefore needs more training and help. They were mindful of things like stretching and distributing the weight of books equally in both the hands to avoid any asymmetry in a growing spine. Posture was an integral part of the curriculum, as important as any other subject. I hope that slouching, which is one of the most under-recognized health issues of our generation, gets its due attention. Ultimately, good posture is the most efficient way to use your body.